That's my gavel. As it being a little after 10, I'm going to open the Criminal Justice Subcommittee work session on House Bill 470 relative to fentanyl test strips and other drug checking equipment. If I could have everyone please rise and join me in the Pledge of Allegiance. Okay, thank you, everyone. I'm going to take a slight recess as we try to find our last remaining representative. So I will temporarily pause the meeting, recess the meeting. Okay, we will be reopening the subcommittee work session on House Bill 470. After a brief discussion with my clerk, well, we're going to decide that we will go for a vote today. So I'd like to have, if anyone has any information that they'd like to speak about, you certainly can. Representative Newell?
We all knew it was coming. Thank you very much, Mr. Chair. And so I think that this is a wonderful bill. I think that it has been vetted fully in the full committee. We recently passed the legalization of strictly testing and strictly fentanyl and xylazine test strips. That's a wonderful start. What this does is this really it fully fleshes out how we can actually analyze or set up a structure so that we can analyze and know what's on our streets. And so this goes a little bit further in the way that it allows us to have more accurate information. Fentanyl and xylazine test strips, I use the comparison to like a pregnancy test, but that's what it is. You either are or you aren't, It either exists or it doesn't, but it doesn't tell you how much. It doesn't allow you to test for multiple substances, et cetera, et cetera. And so what this does is it allows us to have better information, which ultimately, not only, in the personal way that fentanyl and xylazine test strips empower individuals to be able to make better decisions about, whether or not they want to use substances or not. What this does is this empowers us as a community to be able to better target and better address the things that are creeping into our illicit drug supply. And so I think that this honestly can be nothing but good from all angles. And so I'm very supportive of this bill, if you don't know that yet. And thank you for letting me speak. Yeah, we have an amendment that was proposed. It was discussed the last time around, and I think this was something that made it a little more palatable across the board. It was kind of a compromise thing. So we do have this amendment here, but we never voted on it. It is amendment number 515 from February 14th, 2023. When we went to executive session, this was available, but we decided to retain it instead. So, I'm happy to pass that amendment. I think that they were good changes that that made it so that more people on the committee and hopefully more people in the broader House and in the Senate are more amenable to passing this bill. It's people are more comfortable with it with the amendment. So happy to make a motion to pass that. Make a motion to pass that amendment. Whatever you choose to do today, Chair.
Thank you, Representative. Representative Reed?
Yes, thank you, Mr. Chairman. So the way I read this, we passed the fentanyl test strips as a harm reduction tool. Makes complete sense. And of course, we want to minimize overdose deaths, and we want to provide people with the tools necessary to determine if their drugs contain fentanyl or xylazine. However, this bill is very, very broad, and I have an issue with the drug paraphernalia shall not include drug checking equipment or processing, preparing, packaging, repackaging, storing, or containing nominal amounts for the purpose of drug checking. And the amount that is considered a nominal amount is not more than 10 milligrams. So what we're saying here is that people can walk around with illegal substances less than 10 milligrams, which is a lot, and we can no longer consider those previous stated paraphernalia as paraphernalia. I do not see that as a harm reduction tool. I see that as an enabling and very broad. I feel that that number 9 is too broad and it's more enabling than risk reduction. I am going to have to be an ITL on this. I just feel that, again, this is not helping our substance misuse clients, patients. I see this as enabling. In no way is this going to help them in their journey. If anything, it's going to lead to their demise. So I'm going to be an ITL.
Thank you, Representative. Representative Newell?
Thank you. The one thing that I really wanted to clarify, and I know it was clarified when we were discussing it before, but when we talk about 10 milligrams, I think a lot of us think in terms of like, Tylenol or something that we would get. There's a difference between if it's by weight or by volume. And so when it's talking about 10 milligrams, it's not talking about, something that, we would get in the drugstore and understand that that's that. What they say is it's Lincoln on the head of a penny. So it's a very, very small amount, but and so I did want to clarify that, but the other thing that I wanted to kind of broach here. So in one of the things that we got, one of the letters in support that we got, forget what organization, I think it was R Street. It's anyway. So in one of the letters that we got, there was, kind of a list of references, and I went right down. Of course, I read through all the references because that's fun. Studies and things. There was one, this is New Hampshire Drug Monitoring Initiative through DHHS and or Information Analysis Center. So anyway, so what this does, New Hampshire Drug Monitoring Initiative is a holistic strategy to provide awareness and combat drug distribution and misuse. In line with this approach, the DMI will obtain data from various sources to include but not limited to public health, law enforcement, and EMS, and provide monthly products for stakeholders as well as substantial awareness and releases as needed. So that one that was referenced in the bottom of that letter, because this was in February or March or whatever it was. This was up until October of 2022. So of course I went and I looked it up and found the more accurate or the more updated one. Not only, I think we're all pretty aware that overdose deaths are once again rising substantially. Say it's back to 2016 levels. 11.5% increase in drug overdoses, and that was from 2022. In comparison to 2021, and then it's up 10% higher this time around in 2023. So just kind of that as a baseline. But what's interesting that I found in this information really caught my eye was that one of the things that actually went down, it says EMS Narcan administration incidents. And so, I guess you'd really need to dig into the correlation of why this is, right? But one of the things that really sticks out to me is that we've made Narcan available broadly, so that we are giving it out, we are educating people about it, and that's great. That is a harm reduction tool. So we've intentionally gone out of the way to put way more Narcan out for personal use and taught people how to use it and when they need to use it. And so it's happening more on an individual level, an individual saving another person's life, rather than having to call emergency services and have them come out. That's a whole lot of economic impact in that way. But also, if we kind of draw the parallels here, it's wonderful that the EMS doesn't have to come out, and that, but we will have less information as a result, because EMS is the people who are keeping the record. So we're going to have less information on how many overdoses were reversed, right? So the only reason I call this out is because I feel like there is an analogy here to the way that, it's wonderful that now people can test their own supply and things like that, but we are going to have less accurate numbers because people are doing that individually rather than where it is normally found out, which would be, in a police interaction or something like that, right? Or, overdose or whatever it is. The police are able to understand what is on our streets because of police interactions. If individuals, or just in the same way that people are able to get better statistics on how many overdoses were reversed because they have an interaction with the EMS in another emergency service, right? So I guess the point that I'm trying to get to, and you can tell me if I've actually made this point properly or effectively, is that allowing for situations where people can go easily, reducing barriers without having the criminal punishment hanging over their head, to be able to go and get this information equips our police better. They will be more informed in dealing with these illicit substances being in our drug supply. So, thank you.
I'm just going to interject first. Thank you so much. Just for the record, I'm retired law enforcement, state police. I do want to have that harm reduction and saving lives, but I know firsthand that there's subjects where they overdose, they use Narcan, they're good. An hour later, the police get called back, they overdose, they use Narcan. And it's just a vicious cycle of the addict knowing like, okay, I can live, and I can live. And again, we don't want to see them die, but it seems like they're not taking the steps to see. And I know I'm not an addict. I can't be in an addict's mind, but it seems like they just keep the vicious cycle over and over and over again. Something maybe should be to them to say, I got to get my act straight. I don't know if that's a friend. I know you can speak a lot further on this, but I just know on my side, EMS side, it's the vicious cycle of, okay, I'm going to take as much as I can. Someone hopefully will find me, and then I get my shot. I come back. That's my piece on that, and I'll have Representative Reed speak.
Okay, I think we're muddying the two things here, harm reduction. So the way I see it is, you have your substance misuse issues. So the people who have the substance, procure their substance, I don't see a lot of them testing. However, so say you have a couple and one of the parts of the couple is very concerned about their significant other. They may theoretically test to make sure their partner's okay, or in a group setting, you know, so I am fully supportive of the test strip component. But what we're missing here is the fact that this is still an illicit activity that we should not be encouraging. Being arrested and taken out of that environment for a couple days is not such a bad thing. That to be an addict is to have a demon on your back 24 hours a day. So here we're just like, okay, you know, here's all the stuff you need to do to continue to use. And maybe if you don't die before you have hit rock bottom, you know, but in jail, they may become addicts in jail. I understand that it's not a safe zone always, but it is better than being on the streets, being enabled to continually use. How many addicts' parents or loved ones beg for their family members to be arrested so that they at least know they're safe for a little bit longer? And here, I would, as from a nurse, I would love to see everybody test, use clean needles, do their drugs in a healthy way, but you know that's not reality. And the fact is still, it's an illicit activity that we should not be encouraging. And that's why I have to still say ITL. I don't care about statistics at this point. In reality, we need to help them as best as we can while still providing the, and it's another thing, the big drivers of our crime rate is mental illness and substance abuse. So if we can eliminate some of the substance abuse, our crime rates would improve as well. It's just we need to look at this realistically and not through rose-colored glasses, that if we pass this, everything's going to be great, because you know it's not.
Representative Newman.
I'll just make an observation about what we're going to do here today. And we're not going to pass a bill today. We're not going to ITL a bill today. We're not going to do that. We're going to make a recommendation to the full committee. I've heard two objections made. One objection is that it's not a good idea because of what you said about that it's not a good idea. So it should be ITL. So that's the whole bill. That's fine. If it were down to the point about the 10 milligrams, my opinion about something, if you had something like that and that's the sticking point, then you don't just ITL the bill. You don't do a workaround. You don't kill it, and you would fix that little bit. So I don't know, but it sounds like the bigger problem is the one: should we have it? Should we not have it? I don't know that we're not going to resolve that today. We will make a recommendation. So that's all I have to say about that. And then there will be a bigger discussion when whatever recommendation comes out of what we do here goes to the committee, and that can happen today, or it can happen whenever you all decide to whether you're going to have additional meetings or not. You may just come out with a recommendation today, and then we'll meet again in committee. Thank you.
Thank you, Representative, for helping us newbies figure out the process. Representative Newell, and then Representative Selig.
I just I just wanted to clarify really quickly that I am in no way looking through rose-colored glasses. Um, I was the one to receive the phone call when my fiance at the time and father of my 2 children was pulled over by the state police, and he was then in the police barracks. I used to call him my big, strong, handsome man. Do you want to know what he sounded like on that phone call? That was the beginning of his spiral downward, and it did not take long for him to overdose in our bathroom on the other side of a closed door with my 1-year-old knocking on the door saying, Dada. So I am not looking through rose-colored glasses. What I am looking through is the eyes of a mother who has raised 2 children through stigma, through all of everything that happens, through my own grief. I had my youngest 3 weeks later, clutching pictures of the family that I thought we were going to be welcoming into. I want to make that point because I don't think, I think sometimes we make it very simple and clear cut. And I have spent 15 years getting to know how gray it is and how impactful, and not necessarily in the ways that you think, but in a variety of ways. And one thing I would like to note is that when we are talking about a mental health crisis, there are a variety of reasons, but one that I don't think ever really gets talked about is the fact that we have a generation of people who have lost their authority figures. They have lost their parents, they've lost their uncles, their grandparents. My 2 kids are not abnormal, and people have grown up with that reality. And during all of this reality, it has been illegal and it has been criminalized, and it's just getting worse. So I apologize. I'm very passionate about this. I don't want to dominate the conversation, and I totally get where you're coming from. It's not, contentious whatsoever. I get that, but just to kind of clarify where I'm coming from on this.
Thank you, Representative Selig.
Thank you. So there are a couple things. One, I want to echo Representative Newman's comment about, if it's the 10 milligrams, is there an amount that makes it different, right? Is it 5 milligrams, 2 milligrams, whatever it is? Is there some number that we could get to just on that part alone that might be more palatable and more amenable? Because if that's the sticking point, then that's an easy solve, right? I also want to make a point. It's, if people have addiction, we've historically called them addicts, but that doesn't serve to help. It just serves to add labels, in my experience. But people suffer from addiction, and we know we can't legislate our way out of addiction. We know we can't legislate our way out of mental health, even though our criminal justice system is the biggest provider of mental health care in the state. It doesn't mean that that's the way we're going to solve it, right? By criminalizing all of these things. I was listening to a podcast recently about an organization that people can call when they're using drugs alone, so that there's someone on the phone who knows their name and their address and can call 911 if they realize they've overdosed, right? If the person becomes non-responsive. And the particular story that they featured in this podcast dealt with an overdose situation where, the call recipient was able to call 911. They were able to get there in time. Had it been 1 minute later, it would have been too late. The EMT managed to resuscitate the person. They went to the ER. The next day, they called the hotline back to use again, and were persuaded not to because of the risks of using the day after overdosing, but ultimately did go through a cycle, right? But they kept being in communication with the same person they called the first time. And ultimately, the person worked their own way out of their demons and into rehab and into treatment, and is now answering those calls to help others. And so, this is a harm reduction technique, right? Of a phone call. Doesn't do anything to stop the person from using. It just says, if you're going to use, call here so we can hopefully stop you from dying. I was thinking about Representative Newell's comment about the statistics will go down about Narcan because we don't know it. I think it sort of parallels with COVID and COVID testing. Once we had at-home tests, the numbers nationally appeared to go down, not because cases went down, but because people didn't have to report it, because you could test at home and isolate yourself or not, depending on your choice about responsibility. you know, I think that what I see in this is if we can keep someone who has an addiction issue alive one more day, maybe that's the day they realize, okay, it's time for me to get help. Maybe it's not. Maybe it's going to take them 15 more of those days. Maybe it's going to take them 40 doses of Narcan before they realize. Maybe it's going to take them when they don't even have enough space in their neck to inject into because they've run out of everywhere else before they realize that they're, you know, that they've got nothing left. But giving someone that one more day also gives them that one more chance. And to me, that outweighs everything. There's a Jewish construct of, you know, one who saves a life saves the world. So if we can save a life by doing this, we might save the world. So that's where I'm coming from. So I'm hopeful we can find some number or some path that would be more palatable. I don't support people being addicted. You know, I want to help them become not addicted. I just want to help them find the way forward.
Thank you, Representative Reed.
Okay, so no, I agree, but I would feel much better about all of this if we were able to separate the substance misuse versus the illicit activity. What's catching for me, the 10 milligrams I'm willing to overlook, because I agree. I think, you know, you can take that minuscule amount, whatever, that's just, you're not dealing with the FDA measurements here, you're dealing with street measurements. But the drug paraphernalia, I just can't, if you're going to bring your drug to get tested or you have your drug to test, that's fine. If you have your fentanyl strips and you have your drugs, you know, test it, have at it. My problem lies solely in the definition of paraphernalia, because to me, this is enabling a illicit activity. Shall not include. If we would do away with this, I would feel much better, and I would be willing to keep the nominal amount.
May I ask a clarification question? So if I were to purchase my street supply of illegal substances, illicit substances, and then I want to go get it tested to make sure it's safer for me to use. I'm just trying to understand. So I need some way to transport it with me. And so what I'm trying to understand what, with the drug paraphernalia, like what you're saying would be, I'm trying to understand what your language.
To test your drug, you have your baggie or whatever it comes in, you have your test strip and you dip it. You don't have to bring it anywhere. You can procure your fentanyl test strips, you know, when you go to those, wherever you get your stuff, you know, you go to those mobile clinics come to you or whatever, or you go, they know where to get their fentanyl test strips. So you have 5 or 7 test strips, or however many ever they're given to you. You keep them in your pocket, you get your drug, you test it. You don't need to transport it to some place to have it done. That is my understanding. You procure your test strips, you have them on you. If people are going to those mobile or those on-site clinics, you know, it's still, if you have drugs above 10 milligrams, you know, it's still an illicit activity, you know? So yeah, if you go to those places, it's to get it tested when you get your shower, your food, your clothes, but that's not the only way to do it. You could you could get your extra test strips at those centers to have on you to test in your using site, wherever you're using. It doesn't mean you're transporting it all over the Concord to get tested.
Okay.
That's my understanding.
Yeah, maybe I'm misreading because my understanding is that essentially we're saying just that we're excluding from the definition of drug paraphernalia the testing equipment, and that may be more than just fentanyl test strips. They may be other types of testing equipment. So maybe I'm misreading. So if you could point to me where I should be reading, I'd appreciate it.
Line 9 under the drug paraphernalia, they want to do away with they want to take these words out of the definition of paraphernalia. They want it to paraphernalia not to include but we've already said okay to fentanyl test strips, but drug checking equipment or processing, preparing, packaging, repackaging, storing, containing, you know, so they want to so I don't even know what would be left under paraphernalia if you took all of those words out of the definition. But the drug, I don't know what other things they use to test drugs. I think there's little kits that like for cocaine and stuff. We haven't okayed that. We're just, we passed the fentanyl and the xylazine. But I just think that this definition is too broad. And, again, it's not a harm reduction. It's just taking it away from the illicit activity that it is, in my opinion.
Thank you. Just in my former law enforcement life, looking at the amended portion where it says shall not include drug checking equipment or processing, I have no problem with that next line, preparing, packaging, repackaging, storing, because again, there's an or in between all of these. So preparing, I could have scales, I could have large amounts of baggies. Repackaging could be bales for heroin. Storing could be, again, storing units for cocaine. So that portion there, I do not like. The next portion, containing nominal amounts for the purpose of drug checking. I like the first two. That middle one, obviously we will vote on this and we can strike that out when we talk to Representative Muse, but I like a lot of that, but not that middle portion. Go ahead.
You're looking at the amendment now with,
It's actually within the bill itself.
okay, I'm sorry, I'm trying to,
Yeah. So I think this was the one that Representative Muse got as an amendment and then it got put into the bill. It's on page 2, line 16. We go down to where it's struck out
Oh,
in
yes.
lines 18, 19.
so
And you
you
could
would,
speak upon that, yes.
so you would take out,
I would take out the, where is it here? Preparing, packaging, repackaging, storing. So that should be put back into the statute. Because I see this as a bypass, an end around for a drug trafficker, if you will, to say, I'm just testing this. And it doesn't really list amounts within that section.
okay, thank you for clarifying.
Representative Newman.
So now we've got two places where we agree that the language in the unapproved amendment should be changed. And there should be some assertions, maybe, and some deletions and some different amounts and all of that. So I would think that probably the appropriate role for this subcommittee would be to work on what would be the, whatever the next unapproved amendment is. And then when you convene your next meeting, where I probably won't be here, you can then vote on the two. If there happen to be two opposing amendments, you can vote on the two amendments and you come out with a result or whatever. But I just think that we've accomplished a lot by the discussion we've had here to narrowing down what the objections are to an amendment as it's written.
Thank you. Anyone else? Representative Selig.
Thank you. And thank you for pronouncing my name correctly. I really appreciate that. So if we look at the single page amendment 2023-0515, if we go down to lines 9 and 10, if that were to say drug paraphernalia shall not include drug checking equipment or processing, storing, or containing nominal amounts for the purpose of drug checking, but strikes the words preparing, packaging, and repackaging, is you would be comfortable with, would you be comfortable with that language?
I would, and I think Representative Reed, I don't want to speak for you, but you can interject. It seems like we're in agreement with that. I'm not really caring so much about that amount because
Right.
it is nominal. It's that, like Representative Newell said, it's the Lincoln head. It's tiny, tiny, tiny.
So may I propose we resubmit this amendment with our committee names on it with those changes to present at our next meeting? Can I do that, right? Representative Newman?
You can do, I mean, we can do whatever we want to do. And I mean, you could even go and Brad might have tell something about this. You could I suppose, right now, make an amendment, have the amendment printed up, and then you would be able to vote on that amendment as the recommendation to the full committee. And you could do it in this meeting, or you could choose to go to another meeting. That's up to the chair.
I know we have and thank you, Representative Newman. I know we have real busy schedules, so if we can try to bang this out today, that would be excellent. Representative Newell?
Yeah, and I don't mean to drag it out or anything. Okay, so preparing, I feel like that's something that we could get into really, okay, what does that entail, right? But when we're saying packaging and repackaging, storing, like these things kind of are similar in my mind. I mean, talking about packaging, I mean, that's what you carry it in, right? Like that's what it's contained in. So, I mean, essentially what that would be is like a bag, right? So it's got to be in something to be able to get it to a place where you can test it or whatever. And so I feel like that, in this context makes sense. Of course, it does say for the purpose of drug checking, and then it is, a nominal amount. So that would really, it would have to be a tiny little bit in there. So what we're talking about is, I don't know, itsy bitsy little bags. I just think, I'm not sure why we would take out packaging and repackaging, because I feel like the reason those things are in there is because they're things that it would need to be, by necessity, it would need to be transported in so that you could get it to a place where you could test it. So like I said, I don't mean to belabor the point, but I'm not really sure why we would necessarily need to take those out to accomplish what we're trying to do today.
Thank you.
Can I ask
Representative
a
Reed?
question? So if somebody buys their drugs, and I don't know how they would buy it or what, but I would assume that they would buy a certain amount, they would scoop off a minuscule amount, put it in another bag, and if they didn't have their test strips, bring it to a center to test. I can understand that use of packaging and repackaging, but still, I think that I would be happy if it said drug paraphernalia shall not include fentanyl test strips, packaging, or nominal amounts for drug testing. That is just very narrow, very specific, and not open to interpretation, because if you're going to have your drugs in a bigger bag and you put it in a little bag, you would leave your bigger bag someplace else, I would assume. You wouldn't carry it with you, but you might, but then you wouldn't need to repackage it, because that's a lot of manipulation of a drug that you need to take. I don't know, if I did it, I would bring it all. I wouldn't be doing that.
So I'm looking at this as it's under the fentanyl test strip and other drug checking equipment. We could have someone who's a dealer, a trafficker, that is now going to reference this in their defense. They'll have their fentanyl little baggies to say, look, I'm testing this. And that portion there could exempt them from all of the other stuff that they're possessing within the drug statute. So this is kind of like we're now circumventing another law where, again, the addict and those who are addicted are truly trying to use this to help them, but then you have the very bad apples that are going to say, oh, look at this. A defense attorney is going to look at this and say, my client can't be charged because of this statute. That's just me and my law enforcement brain thinking. So would you like to say something, either side? Representative Newman?
I want to just look at the words, the exact words in the sentence. So it says, drug paraphernalia shall not include drug checking equipment or processing, preparing, packaging, repackaging, storing, or containing a nominal amount for the purpose of drug checking. So it seems to me that last clause in that paragraph says that for each one of these things, the packaging and repackaging is only allowed when whatever is defined, whatever those categories are, when there is only a nominal amount associated with that. So I don't know whether that sentence almost stands up on its own to limit it to everything in this bill would have to be related to a nominal amount.
Thank you. Adding on to that, where it's that last portion where it says preparing, packaging, repackaging, storing, or containing. If we can get rid of or and put shall which contain a nominal amount, so that would then make everything into that one cozy sentence. Yeah, because when I'm looking at that, I'm seeing or, so that's where they're going to circumvent that. If we put shall, we'll get the verbiage for it, but shall, and that will link it all into one sentence. Does this make sense?
So take it. So we'll keep in the packaging and preparing whatnot, but take out the or and change the language to make it specific to the nominal amount.
Yes, that will tie it all in that way there. Again, a bad apple won't be able to now use this as a defense. This will truly help those who are addicted to get their testing, and that's how I view it.
Yes,
Okay.
that I would be comfortable with that. Because it, yes, I think that that makes sense. And yeah.
Yes. Okay. So we will be in recess for a couple minutes. I will now reopen the subcommittee work session on House Bill 470. Representative Selig?
So, if changing the word "or" to a more appropriate word is sufficient, we would be delighted to see the new word or how that works, because I don't know the legal ins and outs, since I'm not a lawyer and I don't play one on TV. But we would be delighted when we reconvene to have that amendment or to see drafts of it in advance of that we can fully support, however the process works, because again, I'm as new as you.
Thank you. Representative Reed?
Okay, I would like to go word by word and see which ones we could agree on. Again, I go back to this being too broad, more moving away from harm reduction to not addressing the illicit activity part of it. So if we can go word by word and see which one we can agree on, I think that would be a good start. So drug equipment as being in, excuse me? Yes, on the amendment on 0515H, lines 9, 10. All right, so drug paraphernalia shall not include, and this is where the sticking points are because I feel it's too broad of a definite, too broad, drug checking equipment. If it doesn't say, if it's limited to fentanyl test strips, I would be okay with that. What are your feelings on that? You want it? Go ahead.
We can have this as an open discussion.
Okay, thank you. I think we need it to be more than just fentanyl test strips, because there's other things that get put into drugs that are also dangerous. And so
But
to
what
me,
test-
leaving it as drug checking equipment is, and I would defer to Representative Newell, who's got far more knowledge.
But do we have other tools to test? I mean, I know we have something for cocaine, but what other equipment is commonly used?
Representative?
So as of now, what we passed out of this committee and on the full House and was also passed through committee in the Senate, full Senate, and signed off on by the governor. What that is, what it ended up being, we passed the testing and analyzing equipment, removing testing and analyzing equipment. I was happy with that. The Senate amended it a little bit and made it so that it only exempts fentanyl and xylazine test strips. And we were fortunate that xylazine test strips had come out right before we had the hearing. So luckily, our Lauren from New Hampshire Harm Reduction Coalition was there with a test strip and saying, we just have this. The thing is, actually, let me just answer the question in the first place. So there are things like testing the test strips. What the test strips do is very simply say whether or not this substance is in it. Even in that context, it's not one thing that tests for fentanyl and xylazine even. It's one for fentanyl,
Right.
one for xylazine. It tells you whether or not it's there, yes or no,
Right.
green or red, right? So what the analyzing equipment is, and there are a variety of things. I was trying to find it in here because, like I said, I printed up all these. I went on a little research binge, but I can send it to the committee subcommittee afterwards. But there was a really good discussion of what, I think it's actually in this one. Okay, so rapid response fentanyl testing strips, BTNX Laboratories Canada. Anyway, that's not the point. But it's right in here. What it was actually is not something that was sent out. This study itself was not, this research itself, paper was not sent out individually. This was in in the list of references of another letter that we got. And so people may not have looked at this. So let me just share the information. There's a TrueNarc. Well, I guess that's the brand name of it, but Raman spectrometer, Thermo Fisher Scientific. Okay, and then there's a Bruker Alpha Fourier Transform Inferred Bruker Optics. What this is this is kind of breaking down things. So, number one, there is equipment that would need to be stationary. It's very expensive. It would need to be stationary. This is like a mass spectrometer that you see on the doctor shows and stuff like that. That would need to be in a specific location where people would need to get to that location. Perhaps there could be mobile, but this would be something that is that is brought to people or people go there. And this is why they would need to bring this, why these other things would need to be legalized so that they can actually transport it there. Or If there is, a grassroots organization that goes out on the street, goes out and finds folks and goes to a place where people are, meets up, has a specific day, something like that, they can take a sample of these things, bring it to their location where they have one of these, big machines, big heavy expensive machines, and be able to test it there. That would break down exactly what's in something, how much of something there is in there. It is the top-notch gold standard of being able to analyze exactly what is in this very small supply of drugs. Then there is kind of an in-between one. So there's the yes or no, very simple yes or no that we've already legalized for some substances. There's the breaks everything down. And then there's a middle one that people would be able to, organizations would be able to bring to locations and be able to analyze something. It would tell you how much, or I'm sorry, it would tell you what is in it, not necessarily how much, as I understand it. Not necessarily break it down, there's this percent and this percent and this percent, but it would be able to tell you that there is this, these, specific things that we are testing for, but more than one. And that would be, it's just invaluable to have this information, to know where things are, to know when things crop up and that kind of stuff. So I hope that's a decent explanation. I can also send you the information about these different
No, so
types.
that's excellent because we're dealing with two different populations here. We're dealing with organizations that are testing to see what's on the street and that's different than the users that are on the street. So we're talking about testing equipment this is this is a broader bill that's going to encompass the organization and the street level. So it's going to, okay, that I can understand. Yeah, people that are running these mobile clinics should be able to have these spectrometers and all those other testing equipment. But isn't that covered under licensing in when they get their, their certifications and licensing to run these mobile units? Isn't that under their umbrella? Is this like redundant?
As I understand it, there are very specific organizations that are exempt from, that are able to provide these things and able to provide these services. It's not a lot. So no, it is not. It's not necessarily redundant. I do think that this was designed in a way that it does allow for individuals to be able to go to a place. So yes, it's very important that we protect people who are working in this area, to be able to do that, like what you're saying, like New Hampshire Harm Reduction Coalition, but also, they also other organizations that are working with people who are struggling with this anyway. But it's also important that people, to my mind, that people are able to go to a place. If there is a central location where individuals who want to test their supply can go to a central, so that wouldn't necessarily be somebody who's covered under their licensure or, an organization or something like that. So first of all, there's very specific organizations. And as far as I know, nowhere near enough, but a very, very small amount of people. And we have a huge problem. I just want to bring this up really quickly. And Ray, I know you want to speak. I think I've covered what I meant to, but I just want to talk about the idea that we have a huge problem in the North Country, and we don't have really a wonderful infrastructure out there. It's more sparse. It's harder for people to access these things. It's harder for people to get to places where there just aren't the support. We've come a long way, baby, but there aren't. There is nowhere near what we need. And it's kind of understandable why, but things like this allow for much more rural areas that don't necessarily have the infrastructure to be able to support people in an institutional way with these people who we allow to do it. I think we also need to provide for folks up in the North Country to be able to access these things as well. And I think, yeah.
Yeah, I think we need a division, a clarification between organizations that provide these services versus the people that are, for your local everyday user. You know what I'm saying? There needs to be a line that says you can have the spectrometer, you could have all the equipment you need to run your organization. And I understand the North Country sparse, but the people up in the North Country certainly should have access to their fentanyl and xylazine test strips, but not the spectrometers and the heavy duty stuff, which would again feed into the trafficking component part of it, which they probably wouldn't have. I don't know.
Thank you, Representative Newman.
Yeah, I agree with what Representative Reed said. I'm trying to figure out, so you have the three types of equipment that you said, but it sounds like the middle and the high end stuff is in an organization. And you say we have passed a law that does the other drugs other than fentanyl. So I'm just wondering, in the North Country, would a user have a spectrometer or any of that kind of stuff, or would they be using the strips? And if we cover them having the test strips that do that, would that be sufficient where we could take this out and put some language in like that?
I just want to
You can answer,
respond.
yes.
Yeah, I just wanted to respond to that. So, yes, I think that it is very helpful and good in the North Country to have fentanyl and xylazine test strips be. I think we can all agree on that. I hope we do because we just passed it. But yes, you're absolutely right. I mean, a spectrometer is not something that a user would have. A spectrometer, I would argue, is probably not even something that a drug dealer would have, right? Or but as far as mobile units are concerned and being able to go out and test something in, somewhere where there is a central location and things like that, those are that I think is a very important element of being able to address things like that in the North Country, because there isn't the physical infrastructure of locations, right? So mobile units are very important in that way.
Do they do that now? Do they go out mobile and people bring stuff, or I mean, what's the situation that you're concerned about?
I do not believe for this type of equipment.
No, I mean, does that happen now that people bring drugs to be tested at these?
No,
Or
it's
that doesn't exist?
It is illegal. I mean,
Okay.
I'll just interject, and then Representative Selig, maybe they can get some sort of exemption like the standalone buildings do for the mobile units. I just think we can't just open this up because, again, as we were saying here, it's just going to open. We do want them to get the help, but until we can get those mobile units up and running, then maybe we can get their exemption. But in the meantime, I'm seeing this as the traffickers, the dealers are just going to circumvent it. Representative Selig.
So I just want to point out that we've been focusing on fentanyl strips, which is great. Obviously, we need to, help people not accidentally have fentanyl or carfentanil or any of the number of drugs. But those aren't the only things I think we need to be testing for. I think, there's other things. If, thinking back a couple of decades, thinking about all of the different things that marijuana, for example, can be laced with, which might include LSD, it might include methamphetamines, it might include other things. And so I think if we limit this to fentanyl and I forget the other one, xylazine test strips, we are making it so that, especially if we ever manage to get marijuana legalized in New Hampshire, but people who might be right now procuring supplies of things like that, by taking out by limiting it to fentanyl and the other test strip, we're making it so that if someone wanted to have some sort of equipment, if it was available to test for other substances, isn't available. And so, I'd want them to have the ability to get things tested for LSD, for, anyway, for other substances besides just those two. And I worry about making the focus too narrow. Again, by keeping it at the nominal amounts, we're taking away the drug dealers, right? Access, but also having done a quick Google search, these spectrometer things are between $50,000 and $70,000 each. So, your average drug dealer's not really likely to be procuring those. So,
Representative Newman.
So I think we have to figure out a way to get the wording to be that specifically for this bill, when we use the word, when we might even put a definition of drug checking equipment in there and put in there that for the purposes of this bill, drug checking equipment is for nominal amounts only. So that you always connect what you're exempting in here to just nominal amounts. Anytime you have drug checking equipment for amounts other than that, it's it doesn't apply generally to where they could get around. But you have to go to the lawyers to do that, to figure out exactly how you connect the two, not nominal and drug checking equipment, and only for this bill.
And
So
we-
I don't know what you think about
Just-
that, or if that can be done.
We'd have to further define nominal if we're still going with the 10 milligrams, because a nominal
Right.
to me to you is,
Yeah.
it's arbitrary.
I understand.
Representative Selig.
So, but if it's that specific, would it make it so that these like mobile units that are going to say homeless encampment, who might have a larger testing capacity, would that eliminate their ability to function? I just want to make sure we're not. I don't know if that's a separate category. I'm sorry.
I'm viewing this as the end user and not the testing centers. So I know as in law enforcement, I can't speak for all of them. I'm not going to go shake down a mobile testing unit and say, oh, look at what you got. I'm going to arrest all of you. That's not how I'm viewing it. Again, I can't speak for all in law enforcement, but I think we're looking at the end user in this particular bill. And yes, I do want those mobile units to happen, especially for the people in the North Country. What are they going to travel 4 hours to test their drugs? That's, I don't know.
I agree with Representative Tenzar and Newman. I think that we could specify in the bill, this is for the end user, and organizations, however we could word it, are exempt. Because police are not gonna arrest mobile units. They're not gonna do that. So, but for clarification.
I would hope not. I would hate for us to accidentally. I know there was another LSR I submitted for research, and they brought forward to me a number of things that I had not even known existed, that my LSR would have caused some serious unintended consequences. And so I just want to make sure that we're not accidentally making things like mobile testing units for harm reduction illegal by framing this too narrowly. I want to make sure we're protecting those abilities.
Thank you, Representative Newell.
Mobile testing units are, thank you. Mobile testing units are only as valuable as the information that they can gather. And that depends on people being able to safely feel safe in bringing what they have to a mobile unit, even in the first place. So, I mean, we would be limiting the ability of those mobile units, of these organizations that we depend on to help us understand what is on the streets. We would be limiting their ability in that people need to be able to bring things there without feeling like they're going to get arrested. I mean, think about this scenario, and I'm not saying like, you know, there's boogeymen out there doing this kind of thing, but think about a mobile unit that sets up on a certain day every week or something like that, right? We have that now. People will go and they'll set up on a certain week. They give out, you know, Narcan, a variety of different things, syringe exchanges, all kinds of different things. So they literally have a schedule where they say, all right, we're going to be here on this week. Now, if somebody feels like they can't be comfortable in bringing something there or accessing those things where if, you know, not to create a boogeyman, but if that is known, then it is also known to law enforcement. Well, it's fish in a barrel. Then people who are coming there, that creates a situation where whether or not that is real to someone in that situation, that is the perception, or it could be the perception. It limits the amount of information we are able to get because it maintains a level of distrust and discomfort and a lack of safety in being able to access those things as well. So people need to feel comfortable. I'm repeating myself now. I'm sorry, but I just want to make sure that what I'm saying is clear. It's creating a situation where it's great that people are there to be able to do this, but people also need to feel that they can go there without the threat of prosecution. And they need to feel comfortable go there as well, or else we're not getting the full benefit of what we're trying to do here.
Thank you. I'm viewing this bill in my law enforcement eyes, and I know that was great that you brought up the fish in the barrel. I do not see law enforcement hiding out in the bushes, seeing people testing, then they go out and then they pull them over. This is me pulling a guy over. Some guy is beating up on his wife or something. I happen to find this. This is not the fish in the barrel. When I was a trooper, there was a methadone clinic in Hudson, and I don't know if it's even there anymore. I 100% tell you that Hudson was not hanging out there just waiting to try to see if these people have methadone on them, heroin. I wasn't doing that either. And I know your concerns that that could happen. There could be law enforcement out there that need a pinch, and they're going to hang out and do that. I view that as almost entrapment to a degree. And I know you're chomping at the bit. You can reply.
I just want to clarify that I'm not saying that that could happen. I'm saying that that could be the perception from people who have already had negative interactions with police, or, I mean, it's criminalized. So I'm making no judgments, and I certainly don't expect that to be the case. But I am trying to look through the perspective of the people who we want to feel safe in accessing this. You know what I mean? So I don't think that either. But I'm just trying to make sure that the point is to reduce barriers. So that we can get the best information, we can know exactly what we're dealing with, and in order to do that, in the context of an illicit substance, the way to do that is to limit the amount, the nominal amount. We've defined the nominal amount. We're talking about changing the language so that we're making sure that all of the language that we have is directly related to that nominal amount. I think that's I think that's a wonderful thing. I think that's really what the goal would be here, right?
Thank you. And Representative Reed, did you have further?
No.
Representative Newman.
I just have a comment for the chair. And I think it is. We are at a point in the decision that you have to make is whether you want to wordsmith this right now, whether you want to get with the lawyers to wordsmith something to do in another meeting or whatever it is. We're really talking about what we want to do with just the words in this amendment to see. I mean, I don't think this amendment's going to go the way it's not going to be approved. We are not going to make a recommendation the way it is now. So you might either want to look at that. You might want to do that today, or you might want to figure out what you want to do based upon what we've discussed today and get the wording so that in a future meeting of the subcommittee or the regular committee, you can make a determination what you want to do.
Thank you again for your sage advice. I definitely will wrap this up. I think with just us 5 here, we might be kind of just going around in circles. Let's get more players involved in this to get other perspectives. But I think we work really well together to really craft this to hopefully get this ought to pass. So we'll have to reconvene at some point for another subcommittee meeting, and I know that's really tough with everything happening and for jobs. But we're going to be adjourning this meeting for a future subcommittee, and hopefully we can try to work on the dates today that work with the main subcommittee. So I will be adjourning this meeting of House Bill 470.